The Kappa Delta chapter of Alpha Phi Alpha Fraternity Incorporated was chartered on February 8, 1975. This year, 2020, marks our 45th anniversary. Our chapter has grown from one school, the University of Connecticut, to 4 additional institutions: Eastern Connecticut State University, the University of Hartford, Trinity College, and Central Connecticut State University. There have been 122 initiates who have come through Kappa Delta. Recently, 2 of our chapter alumni were infected with COVID-19 and experienced serious symptoms. One was hospitalized for 4 days. Thankfully, both brothers have completely recovered. In the spirit of Alpha, the initiates of Kappa Delta spanning 5 decades are uniting together to share with you the following critical information regarding COVID-19. 1-9...
Oh, 6. COVID-19 is now a global pandemic that has engulfed the entire planet at a rate unprecedented in our lifetime. It originated in Wuhan, China, toward the end of 2019. What does COVID-19 stand for? CO stands for corona, VI for virus, D for disease, and 19 for the year of origin, 2019. Coronaviruses are actually a large family of viruses that cause illness, ranging from the common cold to more severe diseases such as Middle East Respiratory Syndrome, otherwise known as MERS, and severe acute respiratory syndrome, otherwise known as SARS. The full name of the virus we call COVID-19 is SARS-CoV-2. It is important for us to understand that scientific advancement is characterized by uncertainty, and there is still much we don't know about COVID-19. But let's not let the inherent uncertainty of scientific advancement make us susceptible to the use or spread of misinformation. Part of our motivation in creating this PSA is to confront this head on. 1-9.
Oh, 6? COVID-19 has had a devastating effect on our entire country. 66,000 deaths and counting as in the end of April. However, a disproportionate number of Black Americans and Latinos are dying. Race data is not yet being collected and reported nationally, but several states and large cities are reporting data by race. On April 6th, Louisiana became the first state to release COVID-19 data by race. COVID-19 inequity in Louisiana reflects the racial inequity we observe all over the U.S., where there are large proportions of Black people. Here are some statistics as in the end of April. In Louisiana, Black people make up 33% of the population, but 70% of COVID-19 deaths. In Mississippi, Black people make up 38% of the population, but 61% of the deaths. These inequities are not only restricted to the South. In Michigan, Black people make up 14% of the population, but 40% of the deaths. In Wisconsin, Black people make up 7% of the population, but 33% of the deaths. In Milwaukee, Black people make up 39% of the population and 71% of the deaths. In Chicago, Black people make up 30% of the population and 56% of the deaths. In New York, which has the country's highest numbers of confirmed cases and deaths, Black people are twice as likely to die as white people. COVID-19 didn't create racial inequity, but has simply revealed to a wider audience the structural, social, and policies of inequities that have disproportionately affected poor people, Black people, Latinos, and Native Americans for over 100 years. 1-9.
Oh, 6. Why the disparities? Well, these numbers reflect persistent racial inequity across the country for common chronic conditions like hypertension, also called high blood pressure, cardiovascular disease, also called heart disease, chronic lung disease, obesity, diabetes, and cancer. An April 8th CDC study found that up to 90% of the most serious COVID-19 cases involve these underlying chronic health conditions, which are more common, more deadly, and strike Black people at younger ages. For example, the rate of diabetes is 66% higher for Blacks than for whites, and hypertension is 49% higher. These disparities help explain why, on average, Black people live 3.5 years less than whites, and that was prior to COVID-19. So given that Black Americans' health across several measures is equivalent to people in much poorer countries with much less sophisticated health technology and care delivery systems, it is no surprise that this virus has had a much more devastating effect on us, as it has on Latinos and Native Americans. 1-9.
Oh, 6. In the early part of this year, few anticipated that COVID-19 would spread to become a global pandemic so quickly. But the degree and speed of COVID-19 infection varies dramatically around the world, and how a country has responded to the outbreak is a major factor. For example, Hong Kong and Singapore quickly focused on testing to identify and treat every case. Their numbers remained low until they relaxed social distancing. Cases surged, so they had to implement social distancing again. Other countries were slow to react, and they have suffered high death rates. Iran and Italy are examples. Sweden has taken a different approach. They chose the strategy of herd immunity. Herd immunity assumes that immunity results from exposure. Those who recover from most viruses are immune to subsequent infection, but it is unclear if COVID-19 will behave like other viruses in this way. We just don't know. We do know that in a population of 10 million, Sweden has about twice the population of its neighbors. As of the end of April, Sweden's death toll is about 5 times higher than in Denmark and 11 times higher than in Norway. African nations have enacted various stages of lockdown with different approaches to testing. For example, Nigeria, a nation of 200 million people, has only conducted 12,000 tests, while South Africa, with 50 million, has conducted 128,000 tests. Botswana, whose population is only 1% of Nigeria's, has conducted over 5,000 tests. Nigeria has documented 1,300 cases of COVID-19 with 40 deaths. Their infections have been concentrated in specific regions which have been under lockdown since March 30th. They are planning on lifting restrictions on May 4th. Across the continent of Africa, there have been just over 1,500 deaths reported. Global health experts regard the U.S. response as worse than almost any other country affected. Unlike these other nations, we still have not implemented a cohesive strategy. Wide-scale testing was only rolled out in mid to late March. We still don't have reliable rapid testing, which is critical to understand how extensive infection is and who to isolate. As of May 1st, 32 states are relaxing social distancing guidelines to some degree, and this could precipitate a surge in midsummer. Most experts agree that this is a real possibility. We are also unsure of the seasonality of COVID-19, and as most of us know, flu cases tend to surge in the fall and winter. 1-9.
Oh, 6. How do people get infected by COVID-19? It is thought to be spread primarily from person to person through microscopic respiratory droplets from an infected person's cough or sneeze. These tiny droplets can reach the mouths or nose of people who are nearby and possibly be inhaled into their lungs. Spread is more likely when people are in close contact with one another within 6 feet, and the likelihood increases with the amount of time someone is exposed to an infected individual. This is why we see such high infection rates where people spend significant time together, like in nursing homes and in prisons. A secondary mode of transmission is coming into contact with a surface or object which has been coughed or sneezed upon. The virus can remain infectious for days on these surfaces. When a person touches an infected surface, then touch their eyes, nose, or mouth, they increase their risk of becoming infected. 19.
Oh, 6. Most people infected with COVID-19 are asymptomatic, but those infected can have any combination of the following symptoms: fever, cough, chills, muscle pain, headache, sore throat, and recent loss of taste or smell. In addition, those infected may also have diarrhea, skin rash, runny nose, red eyes, and extreme fatigue. Those symptoms may appear 2 to 14 days after exposure to the virus. Part of what makes containing the virus so difficult is that many of those infected are asymptomatic, and those with symptoms can assume that they just have a common cold, flu, or allergies. There is still much we don't understand about COVID-19, and our understandings of the symptoms are continuously evolving. 19.
It is important to note that older adults who have underlying medical conditions are at higher risk of developing complications from the COVID-19 virus. These underlying conditions include chronic lung disease, asthma, diabetes, chronic kidney disease, or liver disease. Any of these treatments from cancer or organ transplant, you are also at risk. A history of smoking and other immune deficiencies such as poorly controlled HIV or AIDS, unfortunately, you are also at risk. Black Americans and the Latino populations who have underlying medical conditions are in greater numbers than the general population. Remember, we are all at risk regardless of your age or your health. If you experience any of these conditions, contact your local healthcare provider immediately or go to your local healthcare agency. A fight.
'06. It is critical that you seek out medical attention immediately if you or your loved ones experience any of these symptoms. These symptoms are warning signs: trouble breathing, a persistent pain or pressure in the chest, new confusion or inability to arouse, bluish lips or face. Remember, you may be experiencing other symptoms that may warrant medical attention. Healthcare workers report that COVID-19 patients may suddenly and unpredictably get very sick. Don't hesitate. Call 911. Let dispatchers know that you have the symptoms consistent with COVID-19. First responders will get you to the nearest medical facility that can help you. 19.
Oh, 6. So what can we do about it? Especially since social distancing guidelines are being lifted across the country, it is important for us to protect ourselves and each other. We can take specific steps to be diligent about limiting our risk of exposure. And these are still the best ways to protect ourselves, starting with avoiding those who are already sick, washing our hands for at least 20 seconds with soap and water. If soap and water is not available, then we can use hand sanitizer as long as it has 60% alcohol, covering our nose and mouth in public, and maintaining at least 6 feet from each other while in public.
6. Clean and disinfect frequently touched objects and surfaces around the home. Stay home when you are sick, except to get medical attention. Call first before visiting medical facilities, so necessary precautions can be put into place beforehand. Use delivery services and only go to stores in person when you absolutely need to. Designate one person in the family to run errands. So let's keep up these simple practices and remind each other when we may forget. 9.
Oh, 6. We must stress that there is no known cure for COVID-19. Also, there may be people walking around spreading the disease unknowingly because they're not sick, which is also known as being asymptomatic. As testing has increased, it appears that a large portion of individuals have mild symptoms and can recover at home without medical care. If you think you have COVID-19 or have tested positive, you must self-quarantine for at least 14 days to protect your family and the greater community. If you do test positive for COVID-19, please do the following. Stay home, with the exception of medical care as needed. If you do leave your home, please try not to use public transportation. Isolate yourself from your family and other people. Wear a face covering. Get lots of rest and stay hydrated. Stay in contact with your doctor just in case your condition worsens. Stay isolated for the full 14 days, even if you start to feel better. And only resume normal activities until after your doctor has cleared you. 9.
Oh, 6. Again, scientific advancement is inherently uncertain. There's still a lot that we don't know about COVID-19. Recommendations are constantly evolving from this novel new disease. Anyone can post to social media treatment that worked for someone, but not be representative for most of us. It is imperative that we get information from reliable sources like the Center for Disease Control, the CDC. Historically, we understand that our people are distrustful of our government agencies and institutions in general, and we have good reason to be. However, we all should evaluate the sources of information that we see, then arrive at your own conclusions about the validity of what's being presented before you share it. We challenge you to stay informed about the latest developments regarding the COVID-19 and accept that there are still some unanswerable questions that may seem simple, such as, can someone who's already had it get it again? Make good decisions concerning your health and the health of your family, and use credible sources for health information as our understanding continues to evolve. So when you hear the rumors that Black people are somehow immune because of melanin, squash it. When you hear about a miracle cure, check the source, and if it's not credible, squash it. 9.
I'm here today to talk to you about the coronavirus and how it affected me and my family. Around the middle of March, I went to work, and after going to work, I went to the grocery store, and I came home normally, and a couple days later, some of the items that I purchased at the grocery store, I put on the grill for me and my family. After making or grilling the steaks and bringing them to my wife, I immediately told her to, I didn't want mine at this particular time, and I was going to lay down on the couch. I laid down on the couch for 11 days, doing nothing, just pure exhausted. No eating, no going to the bathroom, no drinking, just exhausted, couldn't move. I had a temperature at that time between 99 and 103 every day. And after 11 days, after I see I couldn't shake it, I called the doctor, and my doctor wrote me a prescription to have the coronavirus test done. In the meantime, he told me to call the ambulance and see if I can get to the emergency room. After calling the ambulance, the first responders came into the home. They tested the oxygen in my blood. It was fine. I didn't have a cough. I was breathing fine. So therefore, they couldn't take me to the emergency room. And I would have to wait for the Corona hotline organization to call me to come have a test done. 7 days later, no call, and I'm still not feeling well. I'm drinking a little bit. I'm not eating too much of anything. I'm still exhausted. And at this point, I called my doctor again. And at this time, he told me to make sure when I call him, tell them I'm having problems breathing and I need to go to the emergency room. When a week later, when I called for the second time, the first responders did not come into the home. It was my responsibility to get outside so they can put me in the ambulance. So my sons got me downstairs, got me to the gurney, and got me in, and I went on to Yale New Haven Hospital. During this process, well, there's a 3-step process when you get to the actual hospital. The first step is to get into a holding area until a emergency bed room comes available. And then, depending on if you test positive, whether you go back home or you get into a hospital room. Well, while I'm in the holding area, a doctor comes up to me and asks and says, and she makes the statement, well, I'm just going to hold your hand, okay? And when she made that statement, it made me think that she thought I wasn't going to make it. And that's how that's when I really started understanding that this is serious and nothing to play with. So 40 minutes later from there, 40 to 45 minutes later, I was moved into an actual emergency room bed where they gave me they tested my lungs. They made sure I didn't have a cough, and they gave me an IV because I was so dehydrated. And during that time, they also checked all my vitals and made sure everything was fine. And then they gave me the test for the coronavirus. 2 hours later, around 11:30, I was told that I tested positive and they were waiting for a hospital bed for me to have, and I was going upstairs to the coronavirus floor. I didn't get into a room till probably 4 hours after that, and when I was brought to the room, I realized how serious this virus is, because everyone was covered head to toe, and they had TVs for the doctors to talk to me through the TV rather than coming in efforts to try to save, not only protecting the doctor and minimizing the risk for the doctors, but also in efforts to save their protective gear, because the nurses and everyone that came in, once they came in, they had to take all their protective gear off and change into another protective gear when they walked out of the room. So during that time, I was there for 4 days, and I'm getting stronger because the IV is getting some fluids into me, and again, no cough, breathing fine. I'm not as exhausted anymore. I'm starting to eat, but I still don't have my taste buds back, and I still have a little fever, but it's going down. 4 days later, during that time, the doctor came in a couple times, and I'm getting stronger, so I'm asking her questions. And the two major questions I asked her was, how does this virus thing work? What is it about? And she said it attacks the lungs. And if that doesn't work, then you die because your lungs are not working. And that was scary to hear, because my second question was, after she told me that I was on the downside of the virus, because it was about 12 days that I had it, and it usually goes through, the process is like 14 to 16 days, and I was on the downside. And I asked her, how would I know if I'm good? How would I know if I'm going through the process? And she looked me straight in the face and said, we'll know you're good because you won't be dead. Either you die or you live with this virus. And that made me really realize why, one, how serious this is, and two, how come it took 4 hours for me to get this room? Because they had to either wait for someone to either go home, and I didn't think that they would send someone home at 3:30, or die. Those are the only two options she spoke of. And 4 days later, I'm getting stronger. I'm eating a little bit. I don't have an appetite, but I'm eating. And she called. It was like 10 at night, and she said, do you have anyone that could pick you up? And I'm thinking, well, it's already 10, maybe tomorrow. And she's like, no, now, someone needs this room. And I called my wife, and she picked me up around 10:30, and I came, and I was told that I just needed to isolate myself for a couple days, but I stayed down in my basement for 11 days, just to make sure, just to cover myself, just to feel comfortable being around the family, because the last thing I wanted was to get one of them sick. So I got back to feeling normal and better, 95, 90, in the 90 percentile of feeling better, probably April 20th. So if you remember when I started, it was probably March 19th. So from March 19th to April 20th, one full month, I was going through this process of the coronavirus. I say this to you all out there, please be careful. Please wear your mask. Please wear your gloves. Please keep your distance, because this is very serious, and I would not want this to happen to anyone, to you or anyone in your family, because it's not a good feeling for not only you for having it, but also what your family will have to go through. Because it wasn't like they were there going through with me. They didn't know. It's not like you get in the ambulance and they can follow you. It's not like that. It's not like Yale New Haven Hospital was going to allow them in. You're there, isolated by yourself. And fortunately for me, I talked to them on the phone, but I didn't know what was going on at the time and how the process worked. So again, please, your mask, your gloves, and your distance. Thank you.
Oh, 6. The Brothers of the Kappa Delta chapter of Alpha Phi Alpha Fraternity Incorporated, in commemoration of 45 years of service, would like to thank you for listening to our message regarding COVID-19. It is our hope that this presentation motivates you to talk with a family member, friend, or mentee about COVID-19 based upon something you learned today. To see the full version of this video, which includes a testimonial from a COVID-19 survivor who was one of our chapter brothers, please go to www.kdalphas.com. We pray that you and your respective families stay safe in these trying times. Please share these messages in the African American, Latino, Native American, and any other community in which you are a part of. First of all, servants of all, we shall transcend all.